Hello, welcome to this learning opportunity for delivering the brief intervention known as Ask, Assist, and Refer, or 2 A's and an R. I am Teresa Brown with the New Hampshire Tobacco Prevention and Cessation Program. I'm very pleased you are able to join me. This is one of 4 modules available to increase your knowledge and skills in working with your patients who use tobacco. The time you spend watching this video will help you work more effectively with your patients. You will learn new ways to engage your patients in productive conversation about their tobacco use and understanding their motivation to change. You will also learn about important referral resources for your patients. By the end of this module, you will know the science and research behind the 2 A's and an R, why it works. You will be able to employ the 2 A's and an R model with your patients, and we will walk you through each step, giving you examples of what to say. Lastly, you will be able to confidently refer your patients for coaching and medications through the New Hampshire Tobacco Helpline 1-800-QuitNow. You can start and stop this learning activity at any time. You will receive a CME or a CEU after successfully completing the assessment and the evaluation form. As busy healthcare providers, you can really see the toll tobacco use takes on your patient's health every day. Some people say effects are 20, 30, even 40 years down the road, but for many patients, they are immediate and real. Tobacco use impacts health conditions like diabetes, mental illness, pregnancy, high blood pressure, high cholesterol that would improve significantly if your patient quit. I'm sure most of you would agree that sometimes your patients feel ambivalent about quitting. They say things like, now's not a good time, I'm under too much stress right now. And this learning activity will show you effective and efficient ways of helping your patients overcome these barriers and give quitting a try. The intervention model that I'm going to share with you doubles the likelihood your patients will quit. Tobacco use, like other addictions, is costly, common, and exacerbates other health conditions because tobacco use is a chronic relapsing condition and a person's desire to quit can change at any time. You want to offer advice and help to quit at each visit. Quitting is a process, and for many patients it takes more than one try. The 2 A's and an R takes as little as 3 minutes and is easy to do. The 2 A's and an R stand for Ask, Assist, and Refer. As an evidence-based intervention, it is one of the best ways to help your patients quit tobacco. The 2 A's and an R intervention is the abbreviated version of the 5 A's found in the U.S. Public Health Service Guidelines on treating tobacco use and dependence. Briefly, you ask every patient, every time, at every encounter about the tobacco use. Next, you assist every patient every time by explaining how their tobacco use is impacting their health right now and in the future. Last, you offer a referral resource where your patient can get more help and support depending on their readiness to commit to quitting. Let's talk about how this looks in more detail. The first step is to ask every patient every time. Many practices start asking about tobacco use when a child turns 12 years old. This includes electronic cigarettes. The most recent data indicates that even high school students are using electronic cigarettes at a much higher rate than combustibles. This is concerning. When the medical assistant rooms the patient, they conduct several screenings on the health risks, gathering information about tobacco use, drug and alcohol use, history of depression, anxiety, and domestic violence. These are important risks to know about, and they can change from appointment to appointment, so ask every time. The medical assistant documents the patient's answers, including the type of tobacco and how much tobacco they're using. Here is an example of an electronic medical record. It is helpful to ask the question in several different ways. Here are some suggestions. We ask all our patients these questions because it's important to know everything that impacts your health. Do you use any tobacco products such as cigars, chew, even electronic cigarettes? Here's another one. Last month when you were here, you indicated you wanted to quit. How are you feeling about that today? Anything change? The next step is to assist every patient who uses tobacco to understand the very real impact smoking has on their health. The message should be personal and relevant to their health condition. When a patient states they're using tobacco, you can explore what they like about using tobacco before jumping in and offering assistance in quitting. Start by asking your patients if they would mind spending a little time talking about tobacco use. so you can understand how best to help them and craft your response in a personal manner. Let them know how using tobacco relates to their visit, whether it's a sore throat, migraine, weight gain, blood pressure, diabetes, COPD, breastfeeding, or even pregnancy. They may not understand the impact that using tobacco has on their health, or they may minimize the impact. They may make statements like, "My mother smoked when she was pregnant with me and I'm fine." Here are some statements you can try. As your healthcare provider, I want you to know that smoking is affecting your health. This could be one of the reasons we can't get your blood pressure under control. Here's another way of saying the same thing. Would it be okay if we spent a few minutes talking about your smoking and how I might be able to help you? You could say, using tobacco impacts the effectiveness of your medication. You have to take more medication for it to be as effective when you're smoking. As your doctor, I recommend that you quit smoking. Do you think you might be able to make a quit attempt within the next month? Or if your patient has just had surgery, smoking affects the healing after surgery. As your healthcare provider, I strongly suggest you quit smoking before you have surgery. I can support you with this. What do you think about making a try within the next month? If your patient is open, you can talk about the use of medication to support any quit attempt. Medication plus counseling, behavior change, coaching, those kinds of strategies does increase quit rates. Module 4 of this learning activity does cover the 7 FDA-approved medications and how they improve quit rate. The module will also cover tobacco use and how that impacts the effectiveness of commonly prescribed medications such as insulin, psychotropics, even caffeine. The last step in the 2A's&R intervention is to refer patients to affordable, accessible resources. Patients usually give lots of good information during these conversations that gives you a sense of their readiness to make a change. Many need time to think about their options and process what you discussed. You can always schedule a follow-up visit or a phone call in the next few weeks to find out how they're doing. Regardless of the commitment to change, give everyone, even the ones who are on the fence about quitting, written material about the New Hampshire Tobacco Helpline 1-800-QUIT-NOW. When they are ready, they can contact them. Tell patients that the New Hampshire Tobacco Helpline 1-800-QUIT-NOW will give them free personalized coaching and mail them free nicotine replacement patches, lozenges, and gum. They will also offer email and text messaging support and educational materials through the website. As healthcare providers, you can make a direct referral to a quit coach at the New Hampshire Tobacco Helpline 1-800-QUIT-NOW. A quit coach will call your patient within 24 hours and offer the same services as if they had called 1-800-QUIT-NOW directly themselves. Module 1 of these learning activities explores the variety of options of the way you can refer a patient to the New Hampshire Tobacco Helpline 1-800-QUIT-NOW. I hope you have found this learning activity of value and feel more confident helping patients deal with their tobacco use. I encourage you to watch the other videos in this series. Also, please feel free to contact me for further assistance. The next segment demonstrates the skills we've been discussing in this learning activity. Hi Andy, thanks for coming in today to talk about your cough. It's been about 4 weeks since I saw you, so how's that medication working? Any improvement for you?
I don't feel like the medication's working. I still feel tired all the time. It's keeping me up at night and it's very difficult to focus at work.
Do you have any idea why that might be?
I don't. I just keep feeling more and more run down every day though.
Well, I have an idea, and I'd like to talk about your smoking today. I see that you're still smoking, so more or less since the last time I saw you, and maybe we could talk a little bit about that.
I was afraid you were going to say that. I don't mind. I know I need to quit. I just haven't been ready with all the stress at work.
Okay, so let's first start with what are the best things that you like about smoking?
I kind of like it because it gives me a break, so it's sort of like my little 10 minutes alone, and when I come back from that I feel focused and energized and I'm able to kind of go through the day that way.
Okay, so smoking gives you that break and that energizing lift. That's not uncommon. I hear that from many patients as one of the main reasons that they enjoy smoking. So give me a few of the not so good things about smoking.
Even though smoking helps me focus right after I've had that smoke break, I find it starting to get distracting because I start thinking about taking my next break. And so I don't always accomplish everything I want, along with the tiredness and the coughing.
So there's the good things about the break and the energizing, and then not so good things about the consistent coughing and and the cravings that lead up to that smoke break. So on a scale of 1 to 10, say 1, you don't have any interest in quitting at all, and a 10, you wish you quit yesterday. Where are you on that scale in confidence that you could perhaps make a quit attempt?
I think I'm probably a 5.
That's fabulous. You're halfway there. Why 5?
I've tried to quit before and I wasn't successful, and I really don't want to fail again.
Well, instead of using the word failure, I like to use the word practice. You're not good at anything until you've practiced a little bit, and smoking is one of those chronic behaviors because of the way the cigarettes work on your brain that it takes many attempts. Quitting is hard. I hear that all the time. That it just takes a lot of efforts. And one of the things I like to do for my patients is refer them to the New Hampshire Tobacco Helpline, 1-800-QuitNow. They have wonderful resources at no cost to you. They have quit coaching, and they're open many hours, 18 hours a day. They're open from 7 in the morning until 1 in the morning. They have quit coaches on call all the time to walk you through those helpful ways to get around the behaviors. And also they have a cost-free nicotine replacement therapy product offering. So you can get free nicotine replacement patches, gum, lozenge, right through the mail, right at your home, and all the quit coaching is done over the phone, so you don't have to go anywhere. How does that sound?
Sounds like a plan. I'm ready to try something different.
Okay, well, quitting is very, very hard. I want you to be the most successful that you can. The combination of their behavior therapy, the talking with the quit coaches, and the nicotine replacement therapy products really give you the most likelihood for success. I see you have Medicare for your insurance, and they don't pay for those nicotine replacement products. So it would be great if you could combine those two therapies and quit successfully with the New Hampshire Tobacco Helpline.
I'm willing to try.
That's great. So let's get together in about 4 weeks and make it a little check-in and see how the quit coaching went. Please do remember, though, that when the quit coaches call you after I refer you, that it'll come up as a 1-800 number on your phone. So expect a 1-800 number in a couple of days, and please answer it. So if you don't mind, I'll make the referral. Is that okay?
Sure. Sounds like a good plan.
Thank you for taking the time to complete this module. To receive a Certificate of Completion, or CEU, for this lesson, you need to complete the 2-part assessment. The links are at the QuitWorks New Hampshire website for you to click through to a survey.